Namaste all the viewers and friends. First of all, we would like to thank all the new subscribers who have subscribed to our channel, and our subscriber base is increasing every day, which we are very happy and thankful to all the subscribers. That puts a responsibility on us to share more and more information, and which I hope we are doing at our best. And we are also very happy to know that several of our patients are also our subscribers of the YouTube channel to understand about health, well-being and disease. That is very happy news for us, because that will help for them to understand about health and in the progress in their treatment to reach their goal much faster and more efficiently. At the same time, my personal request is, please share the information and about our channel to all your groups, friends and relatives, so that right information reaches the right people at the right time to avail services for their good health and well-being. With that, let us jump into our discussion of the topic today. It is trigeminal neuralgia. There are several nerves in our body, just like electrical circuit, how it runs in your house. And there are impulses running, just like electrons running in the wires to switch on the light or do whatever function it is required. Same way, the nerves are also responsible for all the functions of our body, especially the musculoskeletal movement and several of the metabolic functions. All those aspects runs through our nerves. And the nerves emerge from our brain and spreads through whole body. Most of it comes through our spinal cord from the back of the skull and through the spinal cord, and it branches out to rest of the parts of the body. But the creation is so nice that there are some major nerves which directly come from the brain, which we call them as cranial nerves. There are 12 cranial nerves in pairs on either side of our body. Trigeminal is one of the nerves, fifth cranial nerve, which comes from behind our ear and supplies the face on one side and the other symmetry from the other cranial nerve, other side of the trigeminal cranial nerve. So what is its function? It helps us to do all the mastication, all the facial expressions and all the muscular functions which needs to happen on our face. And we all know that how important our facial expressions are when we are interacting socially, personally, in family and our relationships as well. At the same time, it is very important that the muscles function well, because that helps to chew, swallow and feel the food and feel the taste of it, so that also is a very important part of our life. So what exactly happens in neuralgia, trigeminal neuralgia? Neuralgia means pain in the nerve root. There are several reasons why there is pain. It could be inflammation, and it is also understood that the blood vessel which is there at the root of the trigeminal nerve sometimes dilates, which puts a pressure on the nerve, leading to neuralgia. At the same time, there could be some problems with the nerve root or the nerve pathway itself, maybe because of a tumor, or it can be malignant or benign, or it could be because of neuropathic changes in the nerve, or because of aging factors, injuries, surgeries. So many factors can contribute to trigeminal neuralgia. And it is most commonly found in women and who are above 50 or around 50. We find this most commonly according to the statisticians. But what are the trigger factors we need to understand? This is very important because it affects our day-to-day life. Brushing your teeth, chewing, touching your face, or even shaving the face whenever you need to, and a cold air hitting your face, especially in winters, it causes electrical shock like symptoms, and it is very bad. You can't do any function. So that bad the pains will be. It is better experienced than explained. We can't put it in words. That's how it is. So what is the solution for that? There is medication to calm the nerve down, but on a long term, that is not the final solution. we need to try to address the root cause, whether it is inflammation or the blood vessel functioning better, or the pathway through which the nerve goes along, any bony structures which are inflamed or anything, those things needs to be addressed, and also prevent all the triggers as much as possible. So that is the solution for us. So along with medication, we also have alternative or complementary therapies like acupuncture therapy, which is proven and understood very well to how effectively it can manage trigeminal neuralgia. Acupuncture involves inserting very fine needles in specific points. You may feel that would it be on the face? Yes, it would be on the face. But we exactly know where the nerve runs and what are the meridians which are responsible for that in terms of traditional Chinese medicine based acupuncture, and we insert very fine needles which are disposable, sterile, single use, and in a very skillful manner by the registered and qualified doctor. So then what happens when the needle is inserted into a specific point? It releases a lot of neurotransmitters, and it is understood that the function of the nerve improves with acupuncture. Not just with trigeminal neuralgia, in several other neurological conditions, acupuncture has been found to do miracles. Nerve injury has also been revived to a large extent with acupuncture in several cases. In my own experience, I have seen those cases. Coming to some of the cases where we have treated trigeminal neuralgia, 90% of the pain goes away. But of course, it varies from condition to condition and person to person. But when acupuncture done on a regular basis, it helps to maintain the pain or reduce the pain, manage the pain, so that you can carry on with your day-to-day functions of chewing and whatever requirements according to your needs. So that effective acupuncture can be. So if any of you are suffering from it, please approach us or any qualified acupuncturist with registration, so that will help you to manage the pain and depend less on medication. But you may need medication if it is very severe, but the dosage may be lesser. But a combination of medication and acupuncture makes a big difference for your quality of life. That's how acupuncture can be a great help for trigeminal neuralgia. I hope that information was quite helpful for you. Share it, subscribe to our channel. Thanks once again for your valuable time to hear to us. Thank you.